there's a huge stigma about cancer. Okay. Hi, this is Dr. Omar. I'm an oncologist working in Nairobi. So let's go back 30 years ago where HIV, AIDS was, and how the community really looked, and thought about an HIV. I believe cancer is still highly stigmatized topic and a disease on itself. Patients and their families really have not really accepted, or even the community has have really not accepted cancer. I mean, rightly so, nobody can accept the diagnosis. It's a very devastating diagnosis. But I'm talking about the way cancer is really, really, stigmatized. Again, it affects so many things. It affects patients itself. It affects the treatment options available. It affects even the early initiation of cancer treatment. It affects the overall well-being, emotional stress, and psychological and effect of the diagnosis itself. I'm not saying anyone should just accept cancer and say, "Hey, congrats to me! I have stage 4 colon cancer or stage 4 brain tumor," right? But I'm saying the community really needs to destigmatize this disease. Because I believe it's here to stay. Cases are becoming more and more. More people are going to be diagnosed, and in fact, research shows by 2050, millions and millions of patients cancer around the world. Majority will actually be in Africa. So I think the right way to go about this stigma about this cancer and stigmatization is to do patient awareness, community education, educating people on the misinformation that is surrounding around the stigma about cancer, that treatment is available. Yes, some patients might present very late and the options might be few, but that doesn't mean we cannot help them. Similarly, there are success stories in which patients actually could really benefit from a life-saving and life-prolonging cancer therapies and treatment. But because of stigma and a lot of misinformation and lack of acceptance by the community itself, on the background of African culture, religiosity, spirituality, family dynamics, decision-making paradigms of the family and the patient, the cancer patients, all these really stems from the stigma, the fear. I believe it all stems from the fear of the cancer itself as a diagnosis and as a disease. Okay, but really there is hope. Let's give hope. Seek a professional care, know the disease itself, the stage, and what can be done.